This webinar is presented by Readiness Associates. COVID-19 Pandemic, a red flag call to action for American healthcare. By Vern Jeffery, Chief Strategist at Readiness Associates. With research by Ralph Petty, Certified Business Continuity Professional. Knowledge is powerful. These times call for a realistic, calm assessment of the current situation and carefully navigating what is a fragile area between fact and emotion to arrive with the most appropriate and sustainable solutions for each organization. We all need to put our heads and our hearts together to help one another. Lauren Ehrman, a certified nurse practitioner, speaking to Mid-Story, a local publication in Toledo, Ohio, put out a call to fellow healthcare practitioners. She stated, "It's our responsibility to pay attention, to be aware of what's going on around us in the world, even if it's not happening to such an extent here where we live." Ehrman reminds us of the adage, knowledge is power. Whether we like it or not, we are as prepared as we're going to be. The focus has shifted from preparedness to response. We have gone from asking purely hypothetical questions to asking, what should we do next? Despite years of warnings to prepare, more work remains. It's time to marshal resources and play the hand we have dealt ourselves. As members of the greater healthcare community, we can use our unique positioning to inform, comfort, and provide care to those in need. Many countries now face the need to bring the community transmission of coronavirus under control. We see from examples in China and Korea that the course of this outbreak can be altered. Risk consulting firm McKinsey & Company stated that they have identified 3 archetypes, 2 successful and 1 not, that offer valuable lessons for managing the progression of this outbreak. The extraordinary measures implemented by China to limit the spread of this virus can be looked to as the first archetype. After the devastating impact of COVID-19 became evident, China implemented a series of unprecedented measures, building hospitals in 10 days, instituting a lockdown for almost 60 million people, and a significant amount of restrictions for hundreds of millions of others. China has used broad-based surveillance to ensure compliance. These measures have been successful in rapidly reducing the virus, even as much as China has been returning back to business as usual. A second successful archetype for the management of this outbreak involves the use of gradual control through effective use of public health best practices. South Korea experienced rapid case count in the first 2 weeks of this outbreak. However, since then, the number of new cases have dropped steadily, though not as steeply as in China. This was achieved through rigorous implementation of public health tools. Examples include rapid and widespread deployment of testing, rigorous contact tracing, and a focus on healthcare provider safety. The integration of technology in public health has enabled real-time tracking of analytics. Singapore and Taiwan appear to have applied a similar approach. Unsuccessful initial control leading to overwhelmed health systems, unfortunately, is typical of the third archetype for the management of this outbreak. In some outbreaks, where case growth has not been contained, hospital capacity has been overwhelmed. In this archetype, the disproportionate impact on healthcare workers and lack of flexibility in the system create a vicious cycle that makes it harder to bring this epidemic under control. Through emulating success and avoiding past missteps, you can devise effective strategies for your organization's unique circumstances. Social distancing works. Many people wonder if we can't simply protect ourselves by avoiding people with symptoms of respiratory illness. Unfortunately, the answer is no. A recent study sponsored by the National Institutes of Health shows that simply avoiding symptomatic people will not go far enough to curb the COVID-19 pandemic. Researchers have discovered that many individuals can carry the novel coronavirus without showing any of the typical symptoms of COVID-19. fever, dry cough, and shortness of breath. But these asymptomatic or only mildly ill individuals can still shed virus and infect others. According to this study, for every confirmed case of COVID-19, there are likely 5 to 10 other people with undetected infections. The same study also reports that individuals with undetected symptoms were so prevalent in China that they were the infection source for 86% of confirmed cases. Currently, in most places in the United States, and throughout the world, for that matter, officials are advising people to stay at home as much as possible. After China established travel restrictions and social distancing, the spread of COVID-19 slowed considerably. Social distancing helped blunt the pandemic in China, and it will work in other nations, including the United States. While many Americans will likely spend weeks working and studying from home and practicing other social distancing measures, the stakes remain high. This pandemic, if not contained, could well circulate around the globe for a long time to come, at great peril to our loved ones and us. Wash your hands. Really. It seems that the three most prominent social phenomena since the emergence of this COVID-19 outbreak have been the practice of social distancing, admonishments for everyone to wash their hands, and the panic buying of toilet tissue. While there have been no logical explanations for the latter, the first two, while admittedly sometimes annoying to implement, can prevent further spread of this virus and can keep you from contracting it yourself and can save lives. Hand washing with soap and water has been considered a measure of personal hygiene for centuries. There can be no doubt that the advances in hygiene during the 19th and 20th centuries, along with other aspects of modern medicine, have combined to improve both the length and quality of our lives. Basic procedures done well do make a difference. Effective hand washing is one of the simplest and most effective things we can do to reduce the spread of infectious diseases. Human hands are widely known to be the prime vehicles for transferring germs to your nose, mouth, and eyes, or to other surfaces where they can find their way into another person. The Centers for Disease Control and Prevention advises that we all clean our hands often. The CDC recommends washing one's hands with soap and water for at least 20 seconds. They should then be dried with a clean towel. If soap and water are not readily available, hand sanitizer that contains at least 60% alcohol can be used. Cover all the surfaces of your hand with the sanitizing agent and rub them together until they feel dry. It becomes our responsibility as members of extended healthcare communities and as adults to ensure that children are also practicing good hygiene frequently. The elderly may also need assistance with their hand washing practices and may also depend on caregivers and others to assist them. If we take sound preventive advice, like hand washing, to heart, even if doing so seems annoying at times, it can help us all get through this COVID-19 outbreak. Albert England was born in Northern California on Christmas Day in 1925. As a youth, Al, as he is known, was an avid athlete with an affinity for pole vaulting. During World War II, Al deployed with the Army's 100th Division, serving in the unit's embedded elite Ranger Company. The Rangers suffered high casualties as they fought their way through France. Out of the 200 Rangers that Al began his service with, only 13 lived to see the conclusion of the war. Post-war, Al completed his university studies and had a distinguished career as a state-appointed health inspector. He married and had 3 children, including my wife, and today I'm very proud to be able to call Al England my father-in-law. Al currently resides in an assisted living facility in the Pacific Northwest. His is but one of the many thousands of equally touching stories that characterize the noble people who live in America's long-term care communities. It is known that the COVID-19 virus hits the elderly disproportionately hard. The lethality rate of this disease dramatically increases with the age of the afflicted. In recent days, we've heard our elected officials calling for grandparents to potentially sacrifice themselves through exposure to this virus as a consequence of lifting social distancing restrictions in the hopes of preventing a national economic downturn. Al England his fellow residents in senior living facilities across our nation, and I have a personal stake in gaining control over the spread of this virus. I am the chief strategist at Readiness Associates. We are a consulting firm made up of ordinary people who lead extraordinary lives and are in the business of making heroes. More on that later. During my time in the military, I served in both the U.S. Army and Air Force Special Operations units. I participated in numerous training exercises and real-world deployments to support intelligence, counterterrorism, and combat search and rescue missions. I have worked as an EMT, hazmat specialist, and a crisis subject matter expert in the areas of emergency response for the world's leading provider of employee behavioral health benefits packages. At the time, that company provided services to 750 businesses in 92 countries around the world. During my time with them, I was often called upon to present to significant business clients different preparedness and response strategies for managing the then looming H5N1 avian flu, which at the time was seen to have pandemic potential. I am also currently the team leader of the Medical Reserve Corps detachment that is co-located with the Cumberland County, Maine Emergency Management Agency. I've served for 2 years as an active participating member of the Southern Maine Regional Resource Center, which is a local healthcare coalition consisting of nearly 300 organizations. In addition, I've taken an active role in response to both Hurricanes Katrina and Rita. I've completed numerous relevant exercises and training courses over the years. I've even earned the FEMA Professional Development Series certificate. Readiness Associates partners with healthcare organizations and companies of all types to ensure that they are ready for disasters and emergencies, and have instilled the traits of emergency preparedness and resilience into the cultures of their organizations. As I mentioned earlier, at Readiness Associates, we feel that we're in the business of empowering heroes in the form of executives, managers, and staff members all over to take care of their people and save lives. We have heard a lot of chatter in the past few weeks about COVID-19 testing. We know that widespread testing has been key to successful outbreak management in the past. It appears to have been key for nations such as China, Singapore, and South Korea that are successfully reducing the number of daily new cases in their lands. There have been grumbles heard in the United States that we have somehow botched our testing kits or bungled the implementation of our testing program. A successful widespread testing program at a national scale to detect and monitor an infectious virus requires a lot more than just an adequate stockpile of testing kits. It requires a well-developed public health infrastructure and whole government support. The process of COVID-19 testing is somewhat analogous to baking, say, a cake. If you want to bake a cake, you're going to need several items. You're going to need an oven. You're going to need a pan or something similar in which to bake. You're going to need mixing bowls and various other kitchen tools. You're going to need a kitchen in which you do your baking. And of course, you need to have the ingredients available from which the cake will be made. Also, it certainly helps to have some baking experience. COVID-19 testing is every bit as demanding in terms of resource requirements. It requires hardware, facilities, and ingredients. Also, it requires expertise, or lacking that, a minimum amount of just-in-time training to conduct the procedures. While testing kits themselves are an undeniable necessity, the lack of available testing kits should not be allowed to be a scapegoat for a general lack of preparedness. We must accept the fact that our nation's public health infrastructure is not as robust as it needs to be to manage the current outbreak without strain. For insight into what we should do now to make the best of our current situation, we can reflect upon what has been done in the past mass outbreaks. In retrospect, as nations such as China, Singapore, and Taiwan found themselves at the forefront of the SARS outbreak in 2003, the consistent keys to managing that outbreak in all cases were a combination of aggressive testing and transparent case reporting to both domestic and international stakeholders, swift and decisive interventions to promote and impose social distancing, and frequent and consistent public health communications. If mass testing for COVID-19 is implemented throughout our country, we can expect to see testing sites set up by the Federal Emergency Management Agency. The agency is designing its sites to perform as many as 5,000 tests each day, with plans to replenish supplies weekly. Teams from the state's National Guard would aid in setting up the testing centers, as well as providing additional support, such as traffic control. It is within our power to make our personal, organizational, and community situations better. The present situation was influenced by the decisions of the past. We are all positioned to become better prepared. We can change the future now. It is safe to say that most of us lack the experience of living through anything like the COVID-19 pandemic. Stress levels will be higher for all of us, and we can expect that this will be especially so for healthcare workers. Healthcare providers and caregivers are on the front lines of our response to this pandemic. It is important to remember that for healthcare workers to provide care for others, they must make taking care of themselves a top priority. Supporting caregiver health and wellness is not just a good suggestion. The current increased operational tempo throughout our healthcare system makes it imperative for healthcare leaders to implement policies and procedures for the care of caregivers. As stress levels have increased while this virus approaches our communities, places of work, and homes, many of us are feeling frightened, confused, and insecure. The Centers for Disease Control and Prevention lists several symptoms of stress that are likely to manifest during an infectious disease outbreak, including fear and worry about your health and the health of your loved ones, changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, increased use of alcohol, tobacco, and other drugs. The apparent lack of order that often accompanies a crisis can instill feelings of unease in people. Likewise, crisis response usually involves fluidly changing personal responsibilities and daily routines for those directly involved. These can result in responders feeling overwhelmed as they lack the sensations that come naturally to people whose work has a clear structure and purpose. Although people are naturally resilient, even under severe stress, the psychological effects of an event such as COVID-19 outbreak can be significant and long-lasting. Incident-related stress also has longer-term effects, and if not addressed, ultimately results in increased staff turnover and reduced organizational performance. Some strategies can be employed to reduce and manage the psychological toll of events. What we can do to support ourselves. The importance of self-care during stressful times cannot be overemphasized, and all healthcare community members, including administrators, providers, and staff members, are at risk for burnout and secondary trauma. It is possible to come up with a practical, personalized self-care routine for oneself. Due to circumstances, you may not be able to engage in every aspect of your self-care plan daily. However, you should be able to include some elements into your schedule every day. Some suggested practices include trying to eat healthy, well-balanced meals, exercising regularly, getting plenty of sleep, and making time each day to unwind mentally. Take breaks from watching, reading, or listening to news stories, especially those about COVID-19, the pandemic, and this crisis in general. It can be upsetting to hear about the crisis and to see these images repeatedly. Each day, try to do some activities that you enjoy. Connect with others. Share your concerns and how you are feeling with a friend or family member. Maintain healthy relationships. As difficult as it may seem at times to do, maintain a sense of hope and positive thinking. Ask for help if you feel overwhelmed or concerned that COVID-19 is affecting your ability to care for your family and patients as you did before the outbreak. It's essential to remind yourself that it's not selfish to take breaks, nor does working all the time mean that you're going to be making your best contribution. You need to rest and recuperate. Remember, you are not the only person that can save the world. Other people can help. The people you spend the most time with, your co-workers, know you best and can be your biggest supporters. We can all be mutually supportive to one another. One technique for effectively implementing a structure for mutual support among employees in a healthcare setting involves implementing a buddy system. In a buddy system, two caregivers partner together to support each other and monitor each other's stress, workload, and safety. Some suggestions for productive buddy pair interactions include getting to know each other, talk about backgrounds, interests, hobbies, and family, identify each other's strengths and weaknesses, setting up times to check in with each other, listening carefully to one another and sharing experiences and feelings, acknowledging tough situations and recognizing each other's accomplishments, even the small ones, offering to help one another with basic needs such as sharing supplies and transportation, monitoring each other's workloads, encouraging each other to take breaks, and maybe most importantly, sharing opportunities for stress relief, like diet and exercise plans, active relaxation practices such as yoga, and to share some laughs. Additional stress management resources. In most cases, our emotional responses to situations that we encounter come much faster than our intellectual analysis of those same situations, which follow later. This lag in time between our feelings and rationale is a complex trait that has evolved as a life-saving essential to protect our early ancestors. While today, we're not often called upon to run for our lives from a predator, our minds remain wired to figuratively run away from stress whenever the intellectual justification for enduring it is unclear. This fight-or-flight response is not ideal, especially for those of us who knowingly must enter stressful situations to help others, such as first responders and healthcare workers. Take the time to do some research and reach out to available resources for mental and physical wellness. Vetted, credible sources of valuable information are easily accessible. If you or someone you care about are feeling overwhelmed with emotions like sadness, depression, or anxiety, or feel like you want to harm yourself or others, call 911. The Substance Abuse and Mental Health Services Administration has a national helpline. It's 1-800-662-HELP. That's 1-800-662-4357. Or you can text Talk With Us to 66746. The U.S. Department of Veterans Affairs offers a 4-page help sheet entitled Managing Healthcare Worker Stress Associated with the COVID-19 Virus Outbreak. This helpful guide addresses how healthcare workers can manage stress before, during, and after an outbreak. It details steps that healthcare workers can take to be more prepared for the stress that accompanies a viral outbreak, as well as recommendations for stress management best practices. Another excellent resource that is relevant to the healthcare community is a 36-slide presentation by the Substance Abuse and Mental Health Services Administration entitled Self-Care for Disaster Behavioral Health Responders. This presentation dives into the physiology of stress, risk factors that can increase negative stress response, and a variety of self-care skills. The United Nations High Commission for Refugees, otherwise known as the UN Refugee Agency, published a 33-page booklet entitled Managing the Stress of Humanitarian Emergencies that contains information on the definitions and management of stress that healthcare workers may find relevant and applicable to the COVID-19 situation. For a more comprehensive treatment of the subject of traumatic stress, you may benefit from turning to the World Health Organization, which offers a 64-page manual that covers psychological first aid. This guide is for people in a position to help others who have experienced an extremely distressing event. Responding to this COVID-19 pandemic can be both rewarding and stressful. Knowing that you have stress and coping with it as you perform your responsibilities will help you to stay well. This will allow you to keep helping those who are affected. Making sense of conflicting information. The World Health Organization has noted that misinformation regarding this COVID-19 pandemic is a widespread problem. Health officials are calling this phenomenon an infodemic. A concerted effort is underway right now to combat it. Social media continues to be a significant driver in the spread of falsehoods. The ease with which conspiracies are shared and reshared over social media makes stopping something from going viral online almost as tricky as stopping a biological viral outbreak in the real world. Conspiracy theories and misinformation complicate the pandemic. The challenge for all of us, including governments and social media platforms, is how to fight the viral spread of pandemic-related misinformation online. We have seen different waves of misinformation emerge as this pandemic has progressed. First, there was a wave of misinformation about the sources of the virus. Then a second wave consisted of distortions and fabrications around the signs, symptoms, and consequences of this coronavirus. The third wave of misinformation has stuck around and focuses on false cures and false preventive measures. Unfounded recommendations range from the ineffectual to the dangerous, from drinking water infused with lime juice to drinking bleach. There will always be misinformation, especially in today's online world. You do not need to become its victim. You can sift through the misinformation if you know its signs and how to find sources of reliable information. We live in a world where information surrounds us. However, information and knowledge are different things. Transforming information into knowledge requires vetting it. Knowledge is the product of information that has been corroborated, validated, and analyzed, a process that filters out the misinformation. Even information has a shelf life. During a pandemic or other emergency, facts change often. What was once breaking news moves quickly from current to dated. Both circumstances and understanding evolve over time. Early responses to emergencies begin with a lack of essential information and incorrect information. Frequent updates limit missteps as well as the taking of wrong future steps. Though converting information into knowledge is essential, the full goal is more than knowledge, especially now. We want to transform information into knowledge so that we can apply it and gain experience. Our experience yields the knowledge that allows for future breakthroughs. To effectively respond to this COVID-19 pandemic, you need to rapidly learn from your organization's and community's shared experience. You need to update knowledge often, and you need to make knowledge-based decisions that drive thoughtful action steps. Mythbusters. Theories and speculation abound on the internet about COVID-19. To their credit, governments, academic bodies, and scientists are working hard to dispel rumors and put out clear, easily understood truths. The World Health Organization has set up a web page dedicated to this pandemic. This WHO Mythbuster webpage provides clear, easily understandable information that addresses and dispels numerous widespread rumors regarding COVID-19 and this pandemic outbreak in general. Healthcare organizations should now connect with an increasing number of highly reliable sources of information. Open communication among fellow healthcare community members, government and private sector entities at the local, state, and federal levels will help to establish relationships needed to dispel rumors, bust myths, and share actionable knowledge and truth. Preventing the spread of misinformation. Pause, fact check, be skeptical. Some of the same infection control measures used to slow the spread of COVID-19 can metaphorically be employed to impede the viral spread of misinformation about this pandemic. Daily social distancing from social media would not only reduce exposure to misinformation, but according to the CDC, reduce pandemic-related stress. By following a systematic, analytical process, you can minimize the effects of misinformation. Pause before sharing, fact check using multiple sources, and be skeptical. Until a vaccine and a treatment for COVID-19 are found, we must urgently address the here and now and devote our minds and energy to slowing this virus. Here are 6 things for consideration, along with several suggested measures for each, for what members of the healthcare community can do right now to enhance their pandemic response. Number 1, provide our best patient and resident care. First, do no harm. Have a process in place to identify and manage patients and residents with symptoms of respiratory infection. Plan to immediately notify health departments for clusters of respiratory infections or suspected COVID-19. Review your protocol for care of patients and residents with symptoms of respiratory infection. Post signs at facility entrances instructing visitors to stay away if they have fever or symptoms of respiratory infection. Establish criteria and protocol for when visitors will be limited to the facility. Set up means for remote communication between your residents, patients, and visitors. For example, video call applications on cell phones or tablets. Number 2, reduce the impact of the outbreak. Take care of yourself. Wash your hands often with soap and water. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched objects and surfaces using an approved cleaner or spray wipe. Take care of your people. Educate your workforce and communicate policies for absenteeism, cross-training, social distancing, and safe hygiene. Track infected or absent employees to assist in their well-being, and fill critical roles via predetermined succession plans. Review and update as necessary sick leave policies and other occupational health considerations. Number 3, manage our facilities. Here are some CDC recommendations for long-term care facilities. Restrict all visitations, except for certain compassionate care situations, such as end-of-life situations. Cancel all group activities and communal dining. Implement active screening of residents and healthcare professionals for fever and respiratory symptoms. Inventory, organize, and control supplies. Prioritize critical resident care supplies, day-to-day operating supplies, outbreak-specific supplies. Develop a strategy for how priorities will be made in the event that there is a need to allocate limited resident care equipment, pharmaceuticals, or other resources. Number 4, continue to educate and train all personnel in our organizations. Include training on specific details about transmission of the COVID-19 virus, when and how to screen patients and potentially family members, the use of personal protective equipment, when to invoke quarantine and isolation. Include training on ethical decision-making about triage and surge capacity. Conduct exercises that include practicing response roles, implementing all levels of quarantine, managing limited resources, handling mass fatalities, coping with high-stress demands, preparing for the needs of their families if the workers are required to be more engaged or to work in quarantine. Number 5, communicate often, both internally and externally. Communicating truth about the issues is the best way to fight rumors and prevent panic. You must communicate with the right people, at the right time, with the right message. Be a river of information, not an island. Be open, receptive, and social. Ensure that information is available to your employees in the following means: through your facility's newsletter, by posting it on bulletin boards, through signs and reminders posted at prominent locations, through the words and actions of your organization's leadership, on the homepage of your website, as paycheck stuffers, and any other means at your disposal. Number 6, rest, recover, and recuperate. Be a part of the solution, not the problem. If you take care of yourself and your family, you're going to be more effective as a caregiver, in your job, and as a leader. Improving resilience. The varied experiences of businesses, to include healthcare organizations, during the early stages of this pandemic underscore the necessity for considering integral resilience measures as a pillar of good organizational design. A crisis brings out both the best and the worst in people. You can rise to your best and lift others up with you. It is critical for organizations to build trustful, connected relationships with their stakeholders, customers, and industry allies. You can implement a comprehensive program for fortifying your organization's general resilience, which will serve the altruistic ethos of healthcare, which includes the saving and preserving of life. Healthcare organizations can leverage the expertise of consulting firms, such as Readiness Associates, to bridge any gaps in resources, knowledge, and experience to achieve their organizational resilience goals and standards. Watch out for one another. Members of healthcare coalitions, business associations, and social networks can function as a watchdog on behalf of one another. A unified approach to the observation and sharing of risk-related information among the community allows for earlier detection of any changes that could potentially signal future trouble. Through actively collaborating with fellow community members, you'll be more aware of the overall situation than if you were to try and go it alone. Through collaboration, everyone involved can potentially know of emerging risks that could affect their organizations. 3 keys to resilience. The keys to organizational resilience are an ongoing risk assessment, active hazard mitigation, and well-supported incident response plans. Even now, as we find ourselves in response mode in the context of the current COVID-19 outbreak, we must continue our forward thinking and maintain preparedness capabilities for other possible adverse events in our future. Avoiding, preventing, and mitigating risk are the essential strategies for keeping an organization resilient. These strategies depend on an organization proactively assessing and analyzing risks continuously, even while caught up in the chaos of a currently unfolding event. Early evidence is making apparent that what organizations, including nation-states, can do now to manage this COVID-19 outbreak directly correlates to what they had done to be generally more robust and resilient in the past. Consulting firms such as Readiness Associates can help you to assess your organization's current level of readiness, set future milestones and goals for improvement, and define a plan for closing the gap between where you are and where you need to be. The business case for resilience. Lack of preparedness is unacceptable to an organization's stakeholders, customers, and allied businesses, and fuels the risk of detrimental fallout in the wake of an emergency, incident, or disaster. Herein lies the business case for investing in organizational resilience. Most of the effort that leads to a successful outcome in the event of a crisis must occur in advance of the incident taking place. All hazard preparedness. Organizational resilience dovetails with all hazard preparedness. The term all hazard preparedness does not mean attempting to make detailed preparations for everything that could possibly happen. Such an effort would be futile, as there is an endless list of things that could happen. All hazard preparedness seeks to make an organization more robust through a process of determining which essential functions are vulnerable, conceiving of plans to manage those vulnerabilities, and then operationalizing those plans by backstopping them with appropriate support resources and infrastructure. All hazard preparedness is all-encompassing. It not only applies to pandemics, but also to floods, cyber attacks, and all other types of hazards. In the event of a contagious disease outbreak or any other catastrophic event, your healthcare organization must minimize the disruption to caregiving services and protect the health and well-being of your residents and staff members. Consulting firms, such as Readiness Associates, can help you assess your organization's critical systems and processes to determine their weak points. In addition, outside expertise can be enlisted to suggest and devise measures that you can take to limit the exposure of your organization's vulnerabilities to known hazards such as seasonal flooding, disruption of electricity, and even severe winter weather. Ultimately, organizational resilience requires long-term and ongoing efforts to protect life safety. Preserving life is everyone's business. Nowhere is this as obvious as it is in healthcare. To get through any doubts we need look no further than inside ourselves. We have all either sworn oaths, lived creeds, or quietly accepted the burden of our responsibilities. I will leave you with the motto of the United States Air Force Pararescue. These things we do that others may live. Thank you.